So welcome, guys. We've got Dr. Toyin with us today. She's kindly agreed to come on and just share her dental journey. In part one, she was telling us about her interesting route into dentistry, retaking a year at college and moving college to get the grades to go into dental school, and then having to retake a year at dental school and having health issues and finally making it through dental school, and then actually applying for the national recruitment scheme. Things didn't go to plan, and she had to spend 6 months working as a hygienist before finally getting onto the foundation scheme. And that's where we left off at the last episode. So again, thank you, Dr. Toyin, for coming on. And in this episode, let's get into what you've been up to since graduation. But yeah, thank you, Dr. Toyin.
Thank you. In terms of what I've been getting up to since dental school, so completed foundation training, and actually I was really enjoying working as a hygienist. So whilst I was doing foundation training, I would work maybe one or two Saturdays a month as a hygienist.
All right.
And it was a great way to keep the income flowing really well, and invest in some dental equipment. One of the things I really wanted to do that I couldn't as a dental student because I couldn't afford it was to actually go on an elective. So I arranged my own elective at the end of foundation training, or a bit after, I think. And that was great. Amazing opportunity to really do what I'm passionate about, which is helping other people.
Where did you go?
After Kenya.
Okay.
So I stayed in an orphanage for 2 weeks with a group of medics and pharmacists, and so I kind of created my own outreach program. I had posters, I had oral hygiene kits, and I had seminars. So these little sessions that I would hold for the children and for the community, where I would just give basic oral hygiene information and do assessments. With assessments, I would then refer patients that I couldn't fully assess, but anyone that was in pain or a high risk, I thought I would refer them on to local facilities for dental care, further out of where I was staying. But that was an incredible opportunity, and I definitely will be doing that at some point in the next
So
year.
Dental foundation training, the elective in Kenya, and then did you go into self-employed role, or did you go for the dental core trainee route?
So after foundation training, well, when it was coming towards the end, I was considering what to do. I wanted to do hospital training to get more experience in certain areas. I thought if I could get one in what I really enjoyed, which was restorative or surgery, because I felt like in dental school, surgery was something I was quite weak at. It would have been great to have a post in that, or anything other than MaxFax. In my mind, I did not want to do MaxFax. It just felt like I thought it wouldn't be for me. But I did apply for dental foundation training. I don't think I got an offer the first time round. I think over time my confidence has grown, but normally within interviews, I think the anxiety would play up and I wouldn't do particularly well in them. But I didn't get a job the first time round, and then randomly one day I got an email saying that you've been offered a job post, Queen Elizabeth Hospital in Norfolk, and it's oromaxillofacial surgery and orthodontics. And I remember speaking to my trainer at the time about it, and he said, do it. And I said, I don't want to do MaxFax, no thank you. But I thought this is going to be an experience regardless, and I should be grateful that I've actually been offered a place. So I said yes, and it turns out it was an oral surgery post with MaxFax on call sessions. And then there was orthodontics with it, which was just amazing. And I'm so grateful that I'm glad I didn't turn that down, because I had so much hands-on experience with oral surgery there, made some amazing friends and mentors. And in that time, I was able to really overcome what I was really anxious about in the dental environment, which was extraction. So surgicals, wisdom teeth, sedation, did the lot, and it was just amazing. But then I was still getting the max fact experience. It was, I think,
Yeah.
1 in 5 weeks at a different hospital. So I got lots of experience with that. And I made a really good friend. He was also a dental core trainee. And we just decided to work together and really just completely smash the year, make the most of every opportunity. We used to literally, I think it was about once every week or two, just go to the Costa in the hospital and brainstorm the things that we could do to, really polish our CVs.
Yeah.
We used to practice for interviews together, and we decided to apply for dental core training year 2.
Yeah.
At the time, we just thought, why not? Just get more experience, because this year has been amazing. And we both applied and we both got offers, really good offers. So I got Manchester, back to where I graduated from.
Yeah.
And it was initially 6 months of Royal Preston Hospital doing special care, restorative and max fax. And then the other 6 months would be restorative at Manchester Dental Hospital. I was really excited because it covered most of the specialties I was really interested in. And at the time, I was scared of going to Preston because I'd heard that it was a really intense unit. But fortunately for me, the year that I got there, they'd made some changes with the way that they were managing the hours that the DCTs were doing, because they were doing way too many before.
Yeah.
So the year I got there, they'd relaxed things a bit, which was fantastic. And everybody there was really nice, really supportive, really pushed me to make the most of the clinical opportunities. I wrote an article, I wrote clinical guideline, presented nationally, presented at every opportunity in the local sessions. I really made the most of that year.
Yeah.
Sorry, the 6 months rather. And same with Dental Core Training 1, actually. I wrote another publication with my friend then. Did really well in those few months, I'd say. And then going back to Manchester, that was what I was most excited about. I thought, I've had the most amazing 6 months in Preston. I can't even imagine what's waiting for me in Manchester.
I remember that's where I actually got to meet you in Preston. You did your time in Preston. I think I had just finished uni. I think I was in my first year foundation training. And I was thinking, wow, she's so far ahead. I can't wait till I'm at that sort of stage. So, hey, to me, you were doing amazing things at that time.
I loved it. I loved Preston. I just thought, this is so nice.
Yeah.
The hospital's there, everything's so local, and everyone was just so nice and welcoming. I never had a single bad experience there. It was amazing.
Yeah.
So I was thinking the same about Manchester. I got myself a nice 2-bedroom apartment. I thought, I'm going to treat myself, really enjoy this. And I struggled.
Okay.
I didn't struggle with the clinical side this time. I was doing well with cases and all the things that they had to offer. But I think it was going back to the environment where I first really was overwhelmed. So it was interesting going back there. And actually, I never had any issues myself, but seeing how my colleagues were struggling in dental core training and seeing how they could have been better supported, it really left I didn't like that at all. And towards the end of the 6 months, I just was in a situation where I had to decide, did I want to do dental core training 3, or did I want to do stick to general practice? And because I loved restorative, I decided to apply for specialty training in prosthodontics. I applied through the normal route for it, which is where you submit the online application. You then are, if you do well enough, you're offered an interview, and it's really competitive. So I think it was 3 days worth of interviews, and it was at Manchester Dental Hospital, which was perfect. I had worked so hard and put so much effort into it, and I didn't even get past the first morning.
Wow.
And this was something that I really felt was for me. Looking back on it, I think that it wasn't the right path for me, although I still really love restorative and prosthodontics. So what I decided to do at that point, not having gotten an offer for specialist training in pros, I decided, I randomly saw the opportunity to apply for prosthodontics through the ACF route, which is where you're an academic clinical fellow. And so you do part clinical training, working in the dental hospital where you're selected for, and it was actually for London this time. And the other half is where you do research within the research institutes, and you work with all the researchers, and it seems really exciting. So I applied for that.
Where does that get advertised?
This was on Oriole.
Okay.
Normally they come up randomly on Oriole, so I always used to check for jobs. And I saw this one day. They had restorative pros endo, and they had lots of actual other specialties, oral surgery. And I thought, this is amazing. Imagine actually being funded for this. And I applied, and I was fortunate enough to get an interview. Did the interview. I didn't get the job, but actually the feedback was really encouraging. They said stuff like I had a very promising career, I just needed more time. So at that crossroads, I had kind of said, well, hospital training isn't happening this year. I forgot to add, I did apply for DCT3 that year as well.
Okay.
It was the first year they started doing SJTs. So you would go to almost like a centre where you'd have your driving theory test done. So I thought I'd booked it. I actually thought, because I remember seeing an email with the date and time for my SJT, and on the day I went for this SJT, and they said, "Oh, we're sorry that you're not on the system." I was so confused. So I think it just wasn't meant to be. Hospital training, every door shuts. Although I'd done 2 years and it was fantastic, I just decided the best thing to do is go back to London to my foundation practice. That practice, they were so supportive, and I knew they would always take me back. And the patients loved me, so it'd be very easy to settle in. And with the fact that Manchester there was a lot of things going on at once. My health was playing up again. And so I decided to go back home and to really prioritize taking care of myself and getting enough rest and getting the work-life balance right. So I went back to my foundation training practice, worked there for a year, and everything that I'd learned in the hospital. So for example, with endo under a microscope, finding those difficult canals, managing sclerosed canals, dealing with hypodontia patients, working in an environment where you're dealing with medically compromised patients, everything that I learned from working in the hospital, I just applied that into general practice. And the NHS practice where I was working, it was predominantly NHS, and there was minimal private work at that time. So I would spend a lot of time dealing with exempt patients, and I would do endo after endo. I would do everything, and my patients were really grateful. But I realized that the type of dentistry I want to do is more high-end private dentistry, and it's not to do with necessarily making money. It's more because I know what I'm good at. I know I'm a very creative and very visual person. I like aesthetics, and so it was just all kind of pushing towards the direction of find somewhere else to train in private dentistry. And it was a difficult decision to make, because my practice loved me, I loved them, the patients loved me. It was just amazing, and it was close to home. That would be the ideal of a comfortable lifestyle.
Yeah.
But I had to make the decision to leave all of that and to embark on something new.
So, having experienced both general practice and working within the hospital, what type of person would you say hospital dentistry suits, and what type of person would you say general practice suits, having seen both sides?
I would say general practice is for everybody, because it's just about finding the practice that you fit into. It's more about the dynamics of relationships between the team. If you're someone that likes creativity, and you don't want to do necessarily the same type of dentistry every day, then general practice is brilliant. And it's great if you want to feel like you're more autonomous and you're in control of the environment you're in. If you want to feel that you can negotiate on the number of days that you do, then it's great. And you can always choose somewhere that is within where you're comfortable commuting or driving to. In the hospital setting, it's very much you are working in an environment where, I use the word dictated only because there are guidelines in place, there are funding issues, there are a number of factors that are out of your control that you have to work under. And it doesn't mean it's a bad environment, it's just there are a lot of things outside of your control. There's the same amount of paperwork, although it's different. You have to do dictations, there's lots of letters, and there's lots of waiting around for things to happen before you can now move on. Let's say you've got a case and you want to do something that's out of your scope of practice, you want to work with a consultant, you can do all these amazing things to really hone in and build your skills, but you're going to be dependent on somebody else's time. And it depends on what your timetable is saying. Whereas in general practice, if you want to take a day off for a course, you can plan that. Whereas in the hospital, that's not always the case. But one advantage of being in the hospital is depending on the hospital, there's an allocated budget for courses. So within DCT1 and 2, I had to study. I had a study leave budget, so I could go on courses and be reimbursed, which was fantastic, really helpful. So things like that are obviously something that you can really benefit from. But at the same time, you're not going to make as much money those first few years compared to working in general practice. But the skills that you get, especially when you're working in a specialty that you really like and you can see yourself working in long term, then it can be a very streamlined process into doing the hospital training pathway and becoming a consultant or a registrar in your chosen area.
Yeah, no, that's really good, because that's always a struggle when you get into the end of foundation training. Should I go into dental core training, or should I go straight into general practice? I'm sure that'll be helpful for those in that sort of position. So the practice you're in now, I believe it's different from the practice you ended up going to after DCT. So how did you get to the practice you're at now?
So the moment I made that decision that I need to move practices, I think what had happened was I was doing really well in the practice, and other dentists I was being referred patients from other dentists that let's say a patient had complained about another dentist, I was always the dentist they would see to solve the problem and get the patient happy again, which was a great experience. But it was a lot of work. It meant that I was seeing my patients, dealing with other patients. I was also training the vocational dentist the VTE. So she was from Romania, she came here and she was training for her performer number, and I was supervising her, which was really good. But there was so much going on, and I felt that it was just too much. It wasn't what I wanted to do, although I was getting amazing skills in the process. So I made the decision that I'm going to look for a different practice. And I literally just randomly went on Facebook and I saw the group for dental recruitment, and I saw that there was a job going in Bexley Heath, and I just thought, oh, I really like this area. And then I looked into the practice. I went on the Instagram, I did my research, and I realized that this practice was really a really good place to be. The foundation dentists that had trained from there, the last 3 years, had won they'd won Foundation Dentist of the Year, and they'd also won first prize in case presentations. I thought, this is the type of environment where I need to be in, where they are producing award-winning dentists. And it was, the owners are young, and which was great to see people really that are ambitious and they are making a success of dentistry. That's the environment where I want to be in, where I have people to look up to daily. And also, what I liked about the practice was there was an NHS contract. It was less than where I was, which meant that there was less pressure to achieve UDAs and more freedom to explore and really build my private patient lists. And I think that has been, again, a very good decision that I've made, changing into that environment. I didn't even realize how amazing a practice it was until the first week. I remember it was a Friday, the first week of working there. The chief dental officer decides she wants to visit the practice because she wanted to know what magic was happening in this place, that they were producing such amazing award-winning dentists. So on the first day, on the first week there, I'm there at dinner with the previous 3 foundation dentists that had won awards. I'm there with the trainers, and Sarah Hurley sitting next to me, and we're all having a chat. And I just felt like, this happened. This is remarkable. So for me, that practice has been challenging with the growth, but just always remembering that experience reminds me that this is the place that's going to make me the best dentist I can be. It's an amazing practice.
Wow. And you've also been getting active on social media, particularly Instagram, in terms of engaging with the public, specifically to do with dentistry and access to dentistry, and just sharing your dental knowledge. What brought that on, and how's that going?
So I would say I've always been someone that's really passionate about dentistry. My friends, my family, anyone who meets me somehow finds out I'm a dentist, and I always get asked lots of questions about dentistry. You know, do you offer this? Do you offer teeth whitening? And it's pretty much always the same story. And actually, in my previous practice, I built up my own patient list of people that just I'd met, or that I'd known as friends and family. So I just naturally would bring more people into the practice. Being that I'd always get asked questions about dentistry, and it'd always be the same questions, and with friends and family, I thought at some point I need to just put something out there on social media that people that know me can access, and that can answer their questions, and it could be something that anyone could access. So I remember it was January this year, January 2020, I was thinking about it, and I just went on a random course to do with social media and putting your business there on social media. And I thought, oh, I don't want to do this. And the person had said that you should really put your face behind the brand. You are Dr. Toyin, and that is how you'll thrive. And I thought, I don't want to put myself out there on social media. But with the lockdown, I had no excuse. I just felt that this is the time. So I spent a bit of time reading more into social media and marketing strategies and all those things. And I just randomly decided to do a series of videos. So my strategy would be, I would do weekly videos to discuss certain oral health topics and just put it out there, just to help the public and to get them to understand the importance of taking ownership of their own, oral health. And that has just kind of opened doors for other things. It's been amazing, despite what's going on with not being able to see patients in that time during lockdown, being able to still share my advice to people and connecting to people and doing Instagram lives and with different people. It's been amazing, and the page is really growing well.
Yeah.
And I'm anticipate that will continue to do so as long as I remain consistent in it. I don't have a goal or a number in mind. It's just to do what I can to give back and to help people understand dentistry more.
What would you say you've learned, good or bad, about starting an Instagram page for dental purposes?
I would say good that I've learned from it is that people are very supportive. Um, from the moment I made the decision and I put my first post out there, I was quite overwhelmed with the amount of support I got. And I quickly realized that there are a lot of people who don't know enough about dentistry in terms of the general public. So I knew that my strategy was different to a lot of other dental pages. So it worked. And I think when you have the right reasoning and strategy behind social media, it tends to work well. I would say before even launching a page, you've got to know exactly what your framework that you're working towards is and what your goals are, because sometimes with social media, I'm not naturally a social media person, so sometimes I just completely disengage from it. But I did feel there were times where I would be thinking, oh my gosh, am I doing the right thing? Am I growing quickly enough? Am I putting the right information out there? Question yourself. If I'm doing the right thing and my motive is right, it's about helping people. I'm not here to build my patient base. I'm here to give back and to help people. Then it will come back to me in one way or another. And what I wasn't expecting was all these amazing opportunities to start opening itself up.
Yeah.
I felt like me launching myself, or anyone doing it allows people to know that you exist, and then opportunities can come to you because people know where to find you.
Yeah. I think why I like it is the fact that it changes the narrative about dentistry and dentists. Because I think people have had this deep-seated perception that dentists are just terrible to be around. You don't want to go visit the dentist. And I think this actually helps to break down that barrier, because they see Dr. Toyin and they're like, oh, I could go see Dr. Toyin. I'm sure she'll take good care of me. And I think it's good for that reason. It makes us more approachable.
Yeah. I was very intentional about no teeth in the pages, only because I felt that if somebody's really anxious, they might not want to see it. And one way to keep it just about informing people is, let's just make it only informative, no pictures. Yeah. I might change my mind with that, but that's part of my thinking at the moment.
Awesome. And what are you looking forward to at the moment? So are there any things that you're working on or that you're hoping to get involved in, or it's just see how it goes at the moment?
I wish it was see how it goes, but I've got quite a bit going on at the moment. So working in my practice at the moment, even though it's 2.5 days, which is reduced because of the COVID restrictions, it's very busy there, which is good. I'm also just navigating a way to provide more Invisalign treatment to my patients, to people that I know, and just thinking of how to connect with. Yes, although my page wasn't designed to bring in people to see me, that wasn't my aim. It's happening anyway, so I just need to figure out the best platform for people to connect with me and to go to see me at my practice. I'm also now involved in mentoring through the Mentor for Dentists program, which is a series of every month you do an online meeting with a group of people, a group of young dentists. I'm trying to really just do what I can to mentor other students, because my journey has not been conventional, but I think it's always refreshing to hear someone go through lots of struggles, because then when you compare yourself to what I've been through, you might find that, hey, she's done it, I certainly can.
That's it.
So I really need to work on putting myself out there. I've decided and paid, and I'm set up to go on a restorative course. It
Okay.
was cosmetic dentistry and aesthetic restorative dentistry with Chris Orr. So that's a year. Obviously, with working less, I felt, is this the right time to commit to that financially? But it will pay for itself. It's a really good course. So I'm excited about that, upskilling in cosmetic dentistry. I'm also going on the Smile Fast course.
Yeah.
So that's, again, just something else to really build my skills in cosmetic dentistry. So for now, I'm working on continuing to educate people as much as I can, whether it's through mentoring or through my Instagram videos, but also building myself up at the same time in my courses.
Yeah, it's actually interesting that there's so many different things you can get involved with as a dentist. I mean, you've talked about training pathways, dental core training. You've talked about papers, research that you've been into. You've talked about general practice, the social media, and now going on to other courses. And I don't think people realize how involved you can be as a dentist, and the need to continually develop.
Absolutely, yes.
Yeah.
I think for me, I've always reflected on each year what's gone well, what are the things what weaknesses do I need to work on, what do I really enjoy, and I just kind of what's the next step. And over time, what I've been able to do is narrow it down. So I've got all my experience now. What do I really enjoy? Okay, it's cosmetic and general dentistry. So build on that and then see where that takes me.
Okay, so the last question is, what is dentistry to you?
Ooh, that's a great question. Dentistry to me it's my passion. That's the first word that came to mind. Um, I love dentistry. I think I can't imagine not being a dentist. It's really weird considering I never even considered it. I just love the fact that you get to help people, you get to serve your patients. I've always been in customer service roles, so working in that environment is something that I naturally do. I want to ensure that I deliver the best care and service to my patients, and dentistry allows that. It allows me to be independent, to problem solve. It's well remunerated. There's as much variety in it as you choose.
Yeah.
I think it's a no-brainer, and it's also in healthcare, which now more than ever is providing certainty in terms of job structure. I know we've had the lockdown, but in actual fact, dentistry has really recovered well from it, and we will get through this season. Dentistry is my passion.
Thank you. Thank you so much for everything, the first video and this video as well. I'll be sure to put in your Instagram handle in the description. So if people want to find out more, they can get in touch with you. Guys, make sure to subscribe and tune into future videos, turn on your notifications, and we'll see you in the next one.